Hi, it's Amy and Angela with another Skinny segment. So congratulations. If you're watching this video, it's probably because you just recently found out you're pregnant. So let's talk about all the changes that happen to your skin during pregnancy.
It seems like you just put down that positive pregnancy test and your skin's already acting crazy. Your body's like bathing in hormones now, so it's going to cause some significant changes in your skin. But don't worry, just as quickly as these changes come and happen, they're going to disappear probably after the birth.
It's usually temporary. So one of the most common ones is a mask of pregnancy. You've probably heard of it. It's actually referred to as melasma or chloasma. And it's caused by the increase of melanin in your skin. And that's usually caused from all of these hormones, the progesterone and estrogen going through your system. So things you can do to combat this if you are prone to this condition are, number one, wear your sunscreen. Most definitely. Even though sun does not cause the mask of pregnancy, it definitely increases that melanin production, which only makes the situation worse. Another thing is avoid soy. I know we've talked about this in some of our other Skinny segments. Soy has an estrogenic effect, which can further enhance that melanin production, which again makes the situation worse. So avoid both of those things for sure when you're dealing with the mask of pregnancy.
Right. So the next thing is pimple breakouts or acne. This can be a huge problem, especially if you've been prone to acne before you were pregnant. You're going to be more prone to get this, especially in the beginning of your pregnancy. And what happens is because of all of these hormones, your body is creating a lot more oil, and the oil on your skin is just irritating and causing more breakouts. So what can you do? Definitely, we've talked about this in another Skinny segment, definitely avoid the salicylic acid and benzoyl peroxide. These two ingredients have been linked to birth defects, and we want to steer clear of those things. Use something more gentle, a non-harsh type cleanser or toner. Use simple so that it's not going to irritate your skin. You can exfoliate twice a week. That will help you slough off those skin cells and help refreshen your pores to help prevent breakouts.
So by keeping your routine just simple overall.
Yes, a very simple routine.
Will help, definitely.
Don't overcomplicate things, don't overdo things. That's just going to irritate your skin.
So you can also fall on the other end of that spectrum. So you were talking about oily. You can also end up being dry during pregnancy, and that's because, again, those hormones that's going through your system can rob your skin of its oils. So if you're dealing with dry skin, one of the things you want to do for sure is to avoid any harsh cleansers. So maybe going to unscented would be a good step.
Or a non-soap.
A non-soap product. Definitely keep your products very gentle. Also, you can hydrate from the inside out. That's very important. Make sure you're drinking plenty of water, and you can also start incorporating some of the mono and poly unsaturated fats into your diet. So things like nuts, avocados, canola oil, olive oil, all of those things are not only good for your baby, but it also will help with that dryness in your skin. So
two of the biggest things to avoid in this category right here, soda and coffee. Those are two of the biggest dehydrators. So if you are going to continue to drink them, just make up for it with your water and these other good fats.
Absolutely.
Okay, so next on the list is something that you may not have thought of, and that is your newly sensitive skin. When you're pregnant, your skin tends to be way more sensitive than it was before, and even the same products that you were using before are going to react differently on your skin. So
nothing is the same.
No, nothing is the same. So watch for this and use more gentle cleansers, more gentle exfoliants for sure. Don't use anything aggressive. And be careful if you are one of the moms that choose to continue to use hair removers, which we've talked about in another Skinny segment about the risks of using hair removers. But if you are going to continue use, be careful. It might say leave on for 4 minutes, and that may be what you did in the past, but 3 minutes this time around could possibly burn your skin.
So alter your products or alter the time.
Yeah, alter your products, test them sooner, see what's happening. And waxing can also leave you a little bit more raw. So let your esthetician know if you're expecting, and they might possibly have a more sensitive type wax to use on you during this time.
They're the best person to turn to during pregnancy. If you're having any kind of skin conditions, they can help you out with all of those types of things that you're dealing with.
Right.
So, and also one of the things that you can end up getting when you're pregnant.
Something more positive.
Definitely. There is a positive.
Positive note. There is one positive here. that pregnancy glow. So your body is circulating 50% more blood flow during this time. So that leaves you with more plump skin. Your wrinkles are going to be filled in, those fine lines are going to be filled in, and you're going to look glowy, and you're going to have more oil like we've talked about. So this could leave you looking glowy and dewy and just beautiful. So if you're one of the lucky few that gets that, take advantage and enjoy it.
Yeah, it's not all bad, right?
Right.
So, all right, well, I guess that's it for now. So congratulations again, and we'll see you on another one of our skinny segments. Bye-bye.